Hello, my name is Shreyani Upane and I am currently completing my final year of Bachelor's of Nursing at Australian Catholic University. Over the past 3 years, I have gained valued clinical experience in both hospital and aged care settings. And I am now very excited to transition into the role of graduate nurse at Canberra Hospital. I see this role as a unique opportunity to build my skills, continue learning within a supportive environment, and contribute meaningfully to patient-centered care, which align with the value of Canberra Health Services. Throughout my placement and work experience, I have consistently used well developed communication and interpersonal skills to ensure effective and respectful patient care. For example, during my time at Warragul Aged Care, I cared for the resident living with advanced dementia who often become anxious during care activities. I took time to build trust by speaking gently, using non-verbal verbal clues, and involving the resident in simple choice, such as picking their clothes for the day. During my hospital placement, I learned how essential communication is for safe and effective care. For example, while caring for a post-operative patient who was anxious about pain and mobility, I ensure clear explanation, active listening, and involve the patient in their care decision. I also communicate timely observation on the team using the SBAR teamwork framework, which I have learned and practiced consistently throughout my studies. As a future graduate nurse, I understand that effective communication with patient families and the healthcare team helps build trust and lead to better care and outcomes. If I were the one to make a medication error, my first priority would be the patient safety. I would stop, assess for any adverse reaction, notify the RN or senior staff immediately, and follow the appropriate reporting procedures. I understand the importance of transparency, accountability, and learning from such incidents to prevent further errors. In my clinical placement and current role as an undergraduate nurse, I have consistently followed the five rights of medication administration and reinforced my theoretical knowledge. At Warrigal Aged Care, in my role as an undergraduate nurse, I have the opportunity to support safe medication practice by checking medication chart, helping with administration, and asking questions when unsure. Throughout my nursing studies, I have learned about the safe use of high risk medication, how to recognize side effects, and the importance of giving the right drugs to the right person at the right time. These are the skills I will carry with me and continue to build on as a graduate nurse. When I feel overwhelmed with a high number of complex patients, I use several strategies to manage my shift effectively. I also understand the importance of self care and resilience, which was covered in our professional development unit, and how it helps to maintain a safe, effective presence at the bedside as a nurse. First, I prioritize tasks based on how urgent and serious his patient needs are, using clinicals to like A to E assessment to help me focus. I also communicate early and clearly with my team, asking for help or advice from experienced nurses or supervisor when needed. I stay organized by making lists or using handover tools to keep track of what needs to be done. Lastly, I use support resources like clinical educator or mentors, and I remind myself that it's okay to ask for help to provide safe and effective care throughout my shift. Through my university studies and clinical placement, I have developed strong understanding of NSQHS standards, especially in areas such as medication safety, clinical governance, and communication for safety. I have practiced clear and structured handover and regularly participated in bedside safety checks that align with Swiss standards. I believe attending work health and safety training is an important and valuable practice as it helps reinforce safe manual handling techniques, hazard identification, and maintaining a clean and safe environment. I understand that following these standards and WHS practice daily is essential to ensure the safety and well being of both patient and staff. During my clinical placement, I cared for the patient who was anxious and unsure about their care. I made sure to always do what I said I would, showing reliability and building trust. I treat the patient with respect by listening carefully and valuing their concern. I was kind by creating a welcoming and safe environment, helping them feel comfortable. I also supported new approaches from the care team to improve their experience, embarrassing innovation. I do believe that my contribution reflect the Canberra Health Service values of being reliable, progressive, respectful, and kind as a graduate nurse. I will continue to use these values to guide my care, ensuring patients are treated as individuals with dignity and cultural sensitivity. I'm excited to begin my nursing career in a dynamic and inclusive environment like Canberra Hospital. I bring a strong clinical foundation, dedication to continued learning, and a deep commitment to safe person centered care. I believe the graduate nurse program will provide the support and growth I need to transition into a confident and capable registered nurse. Thank you for considering my application.